Hi everyone, thank you for tuning in tonight. My name's Michelle and I've been asked by Glaucoma Australia to present this talk. So I understand this is a lot of people's pre-dinner or dinner light entertainment / education. So thank you for joining in. My talk today is about how to encourage family members to get tested for glaucoma. And my answer to that is it begins with you. Firstly, a little bit about myself. My name is Michelle Phan and I've been an optometrist now for 16 years. I've worked in both regional and metro settings, and I'm currently the director of the Specsavers store in Campbelltown, which is southwest Sydney. There's a picture of most of my team members during a training night, and then another picture there with me and some of the university students that the University of New South Wales sends us for placement. Firstly, let's just get into the state of glaucoma in Australia. So currently 300,000 Australians are formally diagnosed with glaucoma, which means that they already have treatment. And it's understood that for every person that's diagnosed, there's an extra person that also has glaucoma but is undiagnosed and therefore currently don't have the treatment that they need. And if you have glaucoma, then your direct family members are 10 times more likely to have it as well. So this includes your mum and dad, siblings, or children. So what is glaucoma? Glaucoma is the leading cause of irreversible blindness worldwide. It's a disease of the optic nerve, and the optic nerve is like a communication channel between the eyes and the brain. And so you can imagine if this communication channel is degenerating over time, it's going to lead to a narrowing of the peripheral vision, so therefore leading to tunnel vision and then eventually vision loss. Often it is due to a high pressure system inside the eye, but not always the case. As we're learning more and more about glaucoma, we're finding glaucoma in a lot of eyes that have normal pressures by our standards as well. As I said before, it affects the peripheral vision usually, and it usually changes very slowly over time. And it usually affects one eye first before the other. So you can imagine if one eye is being affected and the other eye is currently compensating, in the early stages of glaucoma, there's no noticeable symptoms for the patient. And so this is why early detection is really important, because the earlier you find it, the greater the chance that that treatment is going to be successful in slowing down that progression, so that hopefully by the end of your life, you'll still have good functional vision. This is what a typical sort of moderate to advanced glaucoma patient would see the world as. And usually glaucoma is a hereditary condition, not always, but this is one of the cases that presented to our clinic. There was a mother that came in with 2 teenage sons, and she said she wanted her children to be tested for glaucoma. So I just thought this was a simple, straightforward case of, you know, test the children, confirm to her that everything's okay, and just reassure her, because, you know, most glaucoma cases happen to older adults. But then once she told me that her family has a rare genetic condition that predisposes everybody to have glaucoma in the early age onset, I tested the 2 children, and sure enough, they also had high pressures. And I sent both of these children to the same eye specialist that her other 2 children had already been formally diagnosed and managed by. And these other 2 children, in fact, were diagnosed formally when they were only 12 and 18. So, you know, now this is 4 out of 4 of her children that actually have glaucoma. Now, in this particular example, when the parent brings the children in, the children have no choice but to be tested for glaucoma. But as I said earlier, most glaucoma cases happen to older adults. So it's not that easy to bring older adults in specifically for glaucoma testing. And why is that the case? Well, we have to put ourselves in their shoes. There is the fear of the unknown, and if you don't know a lot about glaucoma, that can be scary. There is the eye pressure test, which is unpleasant, but is over pretty quickly. And then there's the visual field, which is also unpleasant to some degree as well. When I was still an optometrist student at the university, they made all the students sit through a program called the CETA standard on the visual field machine. And that is so we can empathize with our patients. And that used to be a 30-minute test. So you can imagine by the end of it, a lot of us had fallen asleep. We weren't paying attention anymore. And so it looked like we had glaucoma when you don't. And then obviously over time, technology improves itself, and now we have much faster and still very accurate algorithms, such as the CETA Fast and even the CETA Faster. And now that brings it down to sort of 3 to 5 minutes per eye. And, I'm sure in the future there's going to be a CETA Fastus and, perhaps a CETA, speed of light. But, in general, visual fields, you do have to, concentrate to do that test. And then my last point there is well-meaning scare tactics. And what I mean by that is sometimes patients hear certain things about glaucoma, which can be well-meaning. So, for example, if a family member says to them, look, glaucoma, it's a blinding condition, you need to be tested for it. Or, a practitioner might have said, it has no cure, it's this silent loss of vision, that can be very scary for some people to want to come in to be tested for as well. And so then I want to introduce you to the 3 musketeers, okay? These are the 3 main groups of people who, are going to be the main fighters against glaucoma. The first group I've got there are the healthcare providers, and this includes your, optometrists, your ophthalmologists who will, diagnose and manage the condition. We have literature and information groups there, which, like Glaucoma Australia, would arm our patients with a wealth of information. And then you've got that third musketeer there, and perhaps the least recognised, and these are you guys. These are the diagnosed family members. You guys can be ambassadors for your direct family members to be diagnosed early. And, if we all have the same goal, if we're all for one and there is one common goal for all, I think we have a good chance at changing that statement I made before, which is glaucoma will no longer be the leading cause of irreversible blindness in the world. So how soon should you tell your family members? I think you should be tested as soon as, I think they should be tested as soon as you get your formal diagnosis. So when you go and see an ophthalmologist and they tell you you have glaucoma, I think this is the right time to tell your direct family members that they should also be tested. There can also be cultural implications. So, for example, some people don't talk about their health information with their family. Some people might be, worried that they cause unnecessary alarm to their family members, or some people might even feel like their children might blame them, for passing on this, this genetic condition to them. But I think, ultimately you are trying to look out for their health and well-being. So if you come across, from a place of care and you sort of do it in a positive manner, then I think it is important to share the information. So how can we, tell somebody that they potentially have a blinding condition and then do so in a positive way? And my answer to that is just give them the facts. Now, I've written there, every decade, the risk of blindness halves. And that came out of some American and Swedish data. And the reason why their study says this is because if you have a look through history, pre-1960s, we really only had one choice of eye drop, and that was pilocarpine, which is a form of miotic, which means it closes down the pupil size. And if that didn't really work for you, you didn't really have any other real options other than maybe, to go in for surgery. And then when you get to the 1970s, a new gold standard came along, which is timolol, and that's another eye drop. And then by the 1990s, that's when glaucoma eye drops really took off with Xalatan, and that was the new big gun in our arsenal. And then after the year 2000, SLT, which is a type of laser, came along. The surgery techniques became more specialized. And then, 2010 there, I've written MIGS, which means minimally invasive glaucoma surgery. And now you've got all these different options to treat glaucoma. And then while all of the treatment was, improving, so too was research. And so glaucoma research has significantly increased over the last 30 years, in particular, trials around neuroprotection. And what that means is that we're moving away from treating just simply the pressure in the eyes to slow down the progression of glaucoma. We're finding certain types of medication now where, it may not simply drop the pressure in the eyes down too much, but actually protects the optic nerve from damage itself. And then while all this research was going on, our primary care was improving as well. And what I mean by that is that optometrists are looking at the back of the eyes now in a much better way than we ever have. We know more about glaucoma. We have better imaging technology, in particular something called the OCT, which is a scan that most optometrists now readily have in their practices. And with every Specsavers eye test, that OCT scan is free. And then with all of this, the definition of blindness also changed. So this is what the typical definition of blindness used to be, and that's basically just black blindness. And now it's more this, which is legal blindness. So you can see there, while you may not be able to drive a car, you will still have some level of vision left to function reasonably independently. And so, with all of this, my message is that knowledge isn't power. Applied knowledge is power. You can't just simply, hold on to this wealth of information that you have glaucoma. You need to pass it along. And so, if you have family members that you want them to be tested for glaucoma, tell them what they can expect. Firstly, they can expect at the optometrist there's going to be some discussion around the health of their eyes, what their general health is like, what medication they're on, and what their family history is. So how many people there in the family have glaucoma. And then there will be a battery of tests that are carried out. And, you might have all of this, or you might only have some of this. And then, tell your family members also that eye testing is bulk billed. In Australia, we are so lucky to have eye care so readily accessible to us. And then only when it's absolutely necessary, when the optometrist really has a feeling that they may also have glaucoma, will they be referred on to an eye specialist if needed. And sometimes this monitoring process as a glaucoma suspect may take several years before that formal referral is underway. And then if they do end up seeing an ophthalmologist, then again, tell them what they can expect there as well. Tell them that there will be, dilating eye drops where the pupils are going to become bigger and it'll be harder for them to see. And so therefore they have to arrange someone to drive them home. And then tell them that, there are all these different options that are available to them now. So, there's a whole range of different eye drops. So if, one doesn't work, they might give you a different combination of eye drops. And then if that doesn't work, there's a bunch of lasers. And then there's also some surgeries as well if, you're in sort of the more moderate to advanced stages. And then, if your family member does end up going to see an eye specialist like you have been to, tell them also that, questions are going to come up as they go, and they're not going to be at the eye specialist anymore. So, write all these questions down to be ready to ask the eye specialist the next time they go. And then also really important to let them know that all of the follow-up appointments with the eye specialist are really important, and that continued care is important, because really that's the only way we have feedback to see how their glaucoma is progressing. If your glaucoma is fairly stable under your current treatment plan, it may just simply be a case of reassure, keep doing what you're doing, I'll see you again in 6 months. Or, your glaucoma might be progressing and that your current treatment plan needs to be revised, and, things might need to change. And then also, tell your relatives that they have to be really transparent with their eye specialist. They need to have a really good relationship, because, this is going to be an ongoing and long-term thing. So, they have to be transparent about whether they are compliant with their eye drops. It might not be easy to put them in, or they might, forget, or, whatever the case might be. They might have side effects to these eye drops, for example. And so this brings me to my second case. This was another glaucoma patient that wandered into our clinic. She was 65 years old at the time, and she was diagnosed with congenital glaucoma, which means she's known glaucoma for most of her life. And because, she's seen multiple eye specialists throughout her life, she doesn't feel like there's much more for her to know. She only has light perception in one of her eyes that she can currently see out of, so her other eye is completely blind. And so she's currently under no ophthalmological care, because she feels like everything's, she knows it all and she's tried it all. And so if you encounter, one of these people like her, you really should tell her about your friendly ophthalmologist, and tell her that she should, have yet another opinion, because, glaucoma treatment and technology and, there are just so many different options now. And that's exactly what I did with her. I referred her onto a local glaucoma specialist, and, she was quite surprised that there was a wealth of information that she doesn't already know. And so my message is that sometimes all people need is that one missing piece. And sometimes that one missing piece is casually $1 billion. But in all seriousness, sometimes that one missing piece is just a message of positivity and hope. And people just want to know that whether they have early glaucoma or advanced glaucoma, that there are always other options available if needed. And, you should avoid any well-meaning scare tactics on your family, because true blindness is incredibly rare. We have come a long way, and there are many treatment options available. Thank you for listening to my talk, and special thanks to the people who made this talk possible, my mentors, Specsavers and Glaucoma Australia. So I will just hide my slides now, and we will pop over to some of the Q&A questions that have come through. Okay, so the first question is, how soon after diagnosis should I wait before telling my family? Is it a good idea to let them know even when I am a suspect? So that's a really good question. I answered this partly at the beginning, where, when you get your formal diagnosis, that's the time when you should let your family members know. And so when you are a glaucoma suspect, that means that you might be in that suspect loop for years to come. And, you know, perhaps you might never have glaucoma. Perhaps you might do all these, you know, tests for a long time, and we keep telling you that it's normal, and you know, we're just trying to be on the cautious side. So I think, you know, when you get your formal diagnosis is the right time. Now, the next question is, I have glaucoma, but I don't have a family history of glaucoma. Is it important to inform family in this case? Yes, it is, because even if you don't have any known family members with glaucoma, you know, glaucoma still has to start from somebody, so that somebody might be you, unluckily, but you might be surprised. You might be, you know, the first one to raise that you have glaucoma, and then out of nowhere, all these other family members who might already have glaucoma but haven't actually made it, you know, open and known to the rest of the family, and now it's open, and then, you know, out of nowhere, you've got multiple family members with glaucoma. So there's, you know, even more incentive now for your family members to be tested. Now, the next question, I'm going to skip a few because some of these are things that I've discussed in my talk already. But this next one I think is really important. If I have secondary glaucoma from an eye injury, do I have to discuss getting screened for glaucoma with my family? Okay, now this particular question is important because there's different types of glaucoma. Glaucoma is an umbrella term to describe any condition where the nerve at the back of the eye starts to, you know, degenerate over time, causing this peripheral vision loss. And secondary glaucoma is a subgroup of glaucoma where people get this due to something else, and so it's no longer a genetic predisposition. They may be on certain medication where glaucoma is a byproduct of that medication, or, you know, as this question here, they may have had an injury and that, you know, damaged the natural anatomy of the eyes and thus leading to glaucoma. So, you know, if you knew that much about glaucoma, I think if you wanted to be, you know, open and transparent, just to, you know, not scare your family too much, if you are going to get into the details anyway, you can definitely say, look, I have glaucoma, and if you ever hear about it on the media about glaucoma being hereditary, just to let you know, this is not from my genes. This is from, you know, this tree branch hitting my eye when I was a child, for example, just to, you know, give them some peace of mind. Now, the next question is, should family members be informed about narrow angles but no glaucoma? This is, you'll find that different optometrists may say different things about this one, but my feelings are, again, I'll just give you a little bit of background. Narrow angle glaucoma is or acute angle closure glaucoma, I should say, is a smaller subgroup of glaucoma where it's incredibly rare. But what happens is, if you have this particular type of glaucoma, your vision loss happens very quickly. Perhaps within a period of a few weeks, you know, if nothing is done about it, you can lose a big chunk of your vision. And the reason that this is the case is because the pressure in the eyes build up incredibly high over a short space of time. And this is not one of those silent, you know, run-of-the-mill slow-acting glaucomas. This is, you know, you will know exactly that something's really wrong. And, you know, if you have narrow angles, the narrow angle glaucoma type is still hereditary. You know, with all of the current, you know, genetic testing and gene mapping and DNA mapping, there's about sort of 13 different gene loci that says that this particular gene can lead to the narrow angle glaucoma type. So, you know, if you look at the risk-benefit ratio, if you don't currently have glaucoma but you have a narrow angle, but if you tend to have this predisposition where the glaucoma makes you lose vision very quickly, I think this is one of those cases where, even though you don't have that formal diagnosis, you should tell your families as well, because there are times when as optometrists, we find narrow angles, and they don't necessarily have glaucoma as yet, or they haven't had this acute angle closure attack as yet. We send them to the ophthalmologist, and what they do is something called prophylactic PI, or essentially a type of laser where they punch some holes through this bit of anatomy called the trabecular meshwork. And what that does is, if you think of inside our eyes, we have something called a drainage angle, or like a kitchen sink. If that kitchen sink is clogged, it can't drain through, and so that's when the pressure buildup happens. So by creating more holes in our hypothetical sink, that's going to allow the fluid to not be blocked up. So I think it is important to let your family know if you do have narrow angles, because there are a bunch of eye specialists that would treat these to make sure that you don't end up with that type of glaucoma, because the other side of the coin is so disastrous, you can lose vision very quickly. And then the other part of this also is that optometrists don't sort of routinely look at the angles to see if they're narrow or not, because the test for it, called gonioscopy, is not really part of routine testing. So if you tell your family members that I have narrow angles, if you go tell your optometrist that there's a family member with narrow angles, the optometrist is more likely to go check specifically for that type of glaucoma for them. And so we'll go on to the next question now. That was a really good question. The next question is, from what age should my children be tested for glaucoma? This is also a really good question. The age that you were formally diagnosed with glaucoma isn't necessarily the age that glaucoma came along, because as I said earlier, glaucoma can be a very silent and slow condition. So the other part of my talk earlier is that for every decade the risk of blindness halves, because we have all of this new technology and research and whatnot. And so if you were, say, tested at 50 and you were diagnosed at 50, then potentially you might have had glaucoma at 40 and just simply didn't know. And so the advice that my mentors, eye specialists, would tell their patients is that if you were tested at 50 and diagnosed at 50 for glaucoma, you should tell your children to start being tested formally for glaucoma from about 10 years younger than that, so about 40. Now, we should all have routine eye tests anyway, whether you have a predisposition for conditions like glaucoma or not. And that recommendation is something like 2 years for the average patient. But then from that sort of 10 year before you were formally diagnosed, your children should be, more strictly followed up for glaucoma as well. Let's see if there's any more questions. Okay, so this question is, do you think GPs should routinely ask patients if they have a family history of glaucoma and recommend glaucoma screening? I think all healthcare practitioners are a team, and sometimes we send information back to the GP about particular things about a patient's eyes, and that can help them sort of manage the patient in a more holistic approach. So we would definitely appreciate it if GPs can also send the message. Sometimes if we haven't sort of covered that message really well, if the patient has forgotten all the things we've told them, sometimes they hear the word glaucoma and then they forget everything else that we've said to them afterwards, which is how important it is to be tested early. And if you're tested early and you're found early, then the chances of you developing this kind of true blindness is incredibly rare. And so, if the GP knows that a patient already has glaucoma, there's a good chance that the GP has, access to the rest of the family too. So I think I'm all for it. The next question. Okay, will glaucoma for each family member be managed and treated differently? My sister likes to tell me I am on the wrong glaucoma drops because I'm on different ones to her. That's a really, really good question. I think your sister is well-meaning, but you guys are probably on different treatment plans because, you know, when we're thinking of how to treat a glaucoma case, we have to think about a whole bunch of different things in a holistic approach. So we have to think, firstly, you know, how old are you guys? You know, if we have a glaucoma patient who is 30, they're going to have to live another, you know, 70 years. We have to be very, very strict and militant about making sure their pressures are extremely low, because we have to ensure that their vision will stick around for the next 70 years. You know, is certain medications in play here? Your sister might be on, you know, certain steroidal medication if she's had, you know, an organ transplant, for example, and long-term steroids can exacerbate her glaucoma, and so therefore her treatment might be different from yours. And you know, obviously some drops might work well with some people and not necessarily so well with other people. So, you know, while your sister is well-meaning, I think you really should just stick to the advice of what your eye specialist is telling you, and just make sure that, you know, you are sort of following what their advice is. And of course, you know, if you have any questions about, you know, maybe if a different drop is better for you for whatever reason, you know, you can always jot that down and ask your specialist the next time you see them, and they might say, oh no, you know, you're no good for that drop because you have heart condition or something else or other. So yeah, look, there's a lot of different treatment plans because everybody's a little bit different. Okay, so this next question is from Di. Di asked, are females more at risk than males to develop glaucoma? I think there are certain types of glaucoma where females are more likely, and then there are certain types of glaucomas where males are more likely. So I don't want to sort of say females are more likely and then all the males in the, you know, on the talk will think, okay, well then I won't necessarily go get tested because my risk is low. I think, you know, the main risk, and that is truly studied in this particular talk, is to do with family and direct relatives. So, you know, as I said at the beginning there, 10 times more chance of a direct family member having glaucoma if you are formally diagnosed with glaucoma. So, you know, male or female, I think it's important that you go and ask for glaucoma testing. And I think that's it. So we are all good to wrap up now after all these questions. So thank you again for tuning in, and have a good evening.